You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, you can get a fixed set of teeth, a full set of teeth, in just a few appointments. And we're talking about dental implants. With us, we have an expert on the topic, Dr. Agarwal. Dr. Agarwal, welcome to the program.
Thank you, Randy. I appreciate you inviting me onto the program. It's a great honor to be here.
Sure. Now, before we get into today's topic, for people that don't know you, tell us a little bit about your practice. Who's your typical patient? Because you do more than just dental implants.
Yeah. That's a wonderful question, Randy. I think there's a great misconception. Our practice is a general practice. And by that I mean we treat patients of all walks of life, whether they're young, whether they're older, basically everybody, whether they work at a teacher, whether they're fireman, policeman, whether they're a football athlete, whether they're an executive at a company. And in our practice, we do all phases of dentistry, whether it's your typical cleaning, whether it's, hey, you have a toothache, you have some pain you need to be taken care of, whether you need a crown, dentures, implants, obviously, that's what we're here to talk about. But we do all phases of dentistry.
Now, you were known, I guess, as the cosmetic guy, like the go-to guy in North Carolina for cosmetic dentistry. Like when you want a natural-looking smile.
I'm a little humble, so I don't like to talk about
myself. But is that
myself.
true? I mean, that is true.
Yeah, absolutely. Out of dental school, I decided when I was reading journals there that I wanted to be that guy. I wanted to be the guy that loved to do beautiful teeth, make people smile, make them happy. Because the truth is, Randy, and I asked the audience out there is, when's the last time you went to your dentist and they did a filling on you and you got up out of the chair and said, "Oh, thank you so much. I love what you did for me."
Yeah.
And I want to love what I do. I love what I do. I want to go to work and I want to take care of people. I want them to jump up out of the chair and say thank you.
And they do that with when the denture wears, you say, and you give them their teeth back.
Yeah,
they're excited.
I can't even begin to tell you, Randy, how unbelievable what it is. We are truly changing lives. I mean, there is no other way to say it.
With just teeth?
Randy, it's easy to say just teeth for you.
Okay.
You have your teeth. Imagine if you're a denture wearer and every time you chew something, it hurts. Every time you smile, they fall out. You're embarrassed to smile. You're unhappy. You just don't know what's going to happen if you're in a conversation. It hurts. You have abscesses. You have pain all over your mouth. It's easy to say it's just teeth.
Okay.
Imagine what it looks like when you're unhappy with the way you smile, how it affects your life, how it affects your job, how it affects your personality. It's not just teeth. What we're doing is really changing lives. It's specifically, good. I mean, it's when somebody can get a job, when somebody has confidence to go in for that interview, when somebody can smile again, when somebody can look at their grandkids and the grandkids, say, "Hey, why don't you ever smile?" And you can say, "I can smile again." It's more than just
So you hear
teeth.
these stories from patients? It's very nice.
That's why I love what I do. I mean, that is why I'm a dentist. I want to be a dentist that changes people's lives. I want them to get up out of the chair and say thank you, and I want to hug them, and I want them to hug me, and I want to go to bed at night knowing that we've done great things for people.
Now, you have a lot of fun at your office. In fact, from your website and
boy.
from Facebook, I follow you on Facebook, you have some fun. We got to show these photos, by the way. I mean, here's one with the drills going into your mouth. Your staff is dogpiling on you. This one, they're drilling you. This
You're killing me, Randy.
This one, they're on top of you.
Listen, you're killing me.
You have a sense of humor, by
Well,
the way.
let me be very clear. We want to have a great time. I want my office to be a great place to come into. I'm not that stuffy guy that you're afraid of. I want to be that person you can sit down with, open up. I want to listen to you. I want to understand your discomforts. I know what your discomforts are. So we have a great team. And I tell you, that's a great aspect of our office, is our team. They treat you like family. We really treat everybody like family.
So moving on to dental implants and what you could do for denture wearers, a lot of people have dentures where you are?
Randy,
Like thousands?
Tens of thousands. It's estimated that nearly 2/3 of Americans over the age of 60 have dentures without all their teeth. These are people that suffer, they can't eat, they're embarrassed to smile. It's amazing how many people, and the biggest thing I get, and I love it when I get this question because it allows me to let people know they're okay, is they say, "You've never seen anything like me." And I always look at them, and I can say it with confidence because it's true. I say, "You're not alone. You're in the right place. We're here to help you. We love patients like you." And think about that, because somebody that's been embarrassed to smile, embarrassed to speak, unconfident, and they go to somebody and we want them, we want to take care of them. It's a fantastic place.
You say two 4 or 6 implants. They get a full arch of teeth.
Yeah, absolutely.
Is that right?
Yes, we can. One of the beautiful things about technology, the newer implants, the mechanisms, the loading, The surface treatments, we're able to use less implants and use implants where we no longer thought we had bone, and we're able to create a unbelievable smile.
I mean, patients have to be afraid of pain because it
Yeah.
seems very painful.
Randy, it's a very common question. Patients, one of the things that holds people back, what I found with our patient base, the people that we've worked with, is one of the number one reasons they don't come is fear. Okay? And the fear is pain. But what I want to tell people is, with today's technologies, with today's sedation and anesthesia techniques, patients don't remember anything. They wake up to a beautiful smile. It is life-changing. Imagine, Randy, you can walk into my office today with bad teeth, all the problems that go with it, and you can take a nap, and you can wake up, and you're finished.
And like a full arch of teeth.
Yes, absolutely.
Is that right?
Absolutely. It's
Okay,
unbelievable.
but back to pain though, because you never answered the question, by the way.
Yes, I'm a good politician.
Does it? Pain is not something they complain about. I mean,
Randy-
I'm talking about after the procedure.
Yeah.
Because I'm guessing that during the procedure they don't feel anything, but afterwards.
Here's what I say, okay? Because it's the number one fear people have.
Yeah.
It's pain. It's a non-issue, okay? And the
Do
reason
you tell them that when they come in and they worry about
I
pain?
do. I tell them up front. I look at them. I say, you won't believe me right now, okay? But I promise you, with our techniques, with sedation, with today's technologies, the way we do implants, it's a non-issue. You take a couple of ibuprofen. Many of our patients don't feel anything, okay? And it's unbelievable.
Okay, so what are the different categories of dental implant patients that you see?
There are many different implants, okay? There are people that are missing a few teeth, people that are missing just one teeth, people that are missing a few teeth in the back, people that are missing half their teeth, and people that are missing all their teeth. But the bigger category is people that are going to be missing all their teeth. Those are the people I'm worried about. Randy, the reason I'm worried
That
about
means they've been told somewhere else that their teeth have to go.
they've been told or they know.
Okay.
Okay. And the reason I'm worried about them, Randy, is they have a mouthful of infection. And there is a significant link between teeth, gum disease, and your overall body.
Okay.
And it is important for us to help these patients get rid of this infection.
But if they have bad gums, how can they get dental implants?
It's not 20 years ago, Randy.
Okay.
Today's implants are totally different. Imagine you can have a full set of failing teeth that have to come out. Listen, I'm a dentist. My goal is to save teeth.
Okay.
But there comes a time where we've got to take them out. Okay. It's just gotten that point. We can take your teeth out, we can place implants, and we can give you teeth in a single visit.
Even if they have so-called bad gums?
Yes, absolutely. One of the things that people don't realize is when we take the teeth out, the infection goes with it. We'll get it cleaned out, we get the teeth out, we get the infection out, we get it healed. It is, Randy, I can't stress it enough. If the viewers don't learn anything else from me, is if they have bad teeth, do yourself a favor, do your body a favor, do your health, your overall health a favor, take care of it.
Okay. But what if you've been in dentures 30 years and you don't have enough bone? Because your bone goes away. Is that right?
It does. When you lose teeth, it's erosion happens, bone goes away. But Randy, I hear it all the time. Patients will come in and they'll say, hey, I'm just here. Somebody else has already told me I don't have enough bone. But I don't remember ever turning anybody away because they don't have enough bone.
So other dentists have told them they don't have enough bone?
Yes, absolutely.
And you are able to still do dental implants?
The technology is amazing.
Okay.
What we're able to do is we're able to take a 3D x-ray of their jawbone, we're able to visualize exactly how much bone they have, and we're able to use different implants. And see, I think this is one of the things. This is where training and experience comes in.
Okay.
Is not all implants are the same. They make different implants for different patients for different specific areas. And that's what we're great at, is we're not stuck with one thing. We have a myriad of options available to us. So we can do things that other people thought were impossible.
Now we should mention something else, because you told me how it's normally done with dental implants is they go to one person for the surgery, another person that puts a tooth on top, and then they go to another place to get the imaging done.
Yeah.
And you do it right there.
Yeah.
Aside from convenience, is it better for the patient, the fact that you do
Randy,
it all?
no, it's more than just convenience.
More effective treatment?
This is the frustration that made me start doing this.
Okay.
Okay, what would happen? Here's how it typically works. You come in. Let's just take you for example.
All right,
okay?
all right.
You come to the office.
I'm a denture wearer.
You're a
okay.
denture wearer. You
Yeah.
you're looking for a better solution. You're tired of the pain. You're tired of the embarrassment. You're tired of all those. You can't eat steak, corn, all the basic things anymore. Okay. You come in. You come to me. I'm the cosmetic guy. I give beautiful smiles. Okay. In the past, what would happen is I would send you to an imaging center. I would send you then to a surgeon, and then you would come to me to get the teeth done. And things get lost in translation. It's inconvenient, but things get
And
lost.
that's how it's normally done. Is that correct?
It's unfortunately
You
still
say?
done in many places that way.
Okay.
And what we did, I got frustrated. I said, there's got to be a better way. And the better way was bringing everything into our office. We have a surgical suite, we have the imaging technology, and we have the Smile Make.
Okay. Now, for the sake of time, you brought some photos.
Yes.
So what'd you bring us?
Yes, absolutely, Randy. I want to start with one of my favorite cases.
Okay.
I want you to take a look at this case. Now, what I want you to understand is she's smiling in this photo, but I had to force her to smile. It took me 10 pictures to get that smile. She simply didn't smile.
Okay.
Not at all. She was embarrassed. She didn't like the way her teeth looked. She wasn't able to chew very well. She just wasn't happy. She covers her mouth with her hand. She just wasn't happy. It was embarrassing for her.
So what was her problem?
Let's take a closer look, Randy. Okay. What you can see here
boy.
is these lower teeth are not in great shape. There's chronic infection.
But that's got to be unusual. This bad.
Yeah, Randy, it's not. But here's what I tell patients when they say this to me. I say it's unusual to you because people who have these problems, they don't smile. You don't see them smiling.
point.
You don't see their issues. So it's not unusual. But you never see it because those people are never smiling.
Interesting.
So in her case, she has lower teeth, chronic infection. The teeth have to come out. There's just no choice but to have those teeth come out. And we're able to use implants to help give her fixed teeth that are secure and in place.
Let's take a look at this.
Just take a look at this, Randy. It's amazing.
That's very nice. It's very cosmetic.
Yeah, absolutely. Here's what I want you to do, Randy. Forget about the before and after close-up pic. Those are for dentists.
Okay.
I want you to put her before picture and her after picture, face picture side by side.
Wow.
Now, just put yourself in the shoe. Randy, you're hiring somebody for your studio. Okay?
Good point.
This patient walks in and this patient walks in. Who are you hiring?
Well, with all things being equal, obviously, if the one is smiling and one isn't, you're going to hire the positive person, the one that appears to be healthy.
What you see is amazing. We're just finished. She's holding back. She's not used to smiling yet. Just imagine, give her a few weeks. When she gets used to, imagine she's going to go to her friends who've never seen her smile before, or her grandkids who've never seen her smile before, and they give her that first compliment. Wow, you look great. And the beauty of what we do, Randy, is we don't make fake teeth. We make teeth that look like they're part of you. The worst thing that can happen is somebody say, oh, you have fake teeth. We make teeth that fit in their face, that look fantastic.
Yeah, because I feel like I could spot a denture.
Yeah, not my dentures.
10 feet away.
Not my dentures. Let's take a look at our next case.
Okay.
Okay, I want you to see this one. That's her smile. There is no smile. She doesn't smile. She's embarrassed. She has pain. And she's a salesperson, let's say.
Okay.
How does that affect your life?
Yeah.
You know, how does that affect your love life, your relationships?
So what did she have in there? She had a denture?
She had an old denture that just didn't fit well. And honestly, Randy, it looked like dentures.
Okay.
And that's what we do differently.
So what do they say when they come in? I mean, like, what are my options?
It's amazing to me. I take for granted as a dentist, as a professional, is people don't even know what's available. Our profession has done a bad job. That's what I'm here to change. Our profession has done a bad job of letting people know what's possible and how much easier it is today than it used to be.
Okay.
And so they don't even know what's possible.
So with her, she has a loose-fitting denture.
Loose-fitting dentures,
like
they look like dentures. She's unhappy with the way they look. And the first thing she said is, I just want beautiful teeth.
Okay.
She didn't say, hey, I want implants. She wants beautiful teeth. And the implants are going to help us to give her teeth that stay in her mouth. It's nothing short of amazing.
Do you have the after? Do you have the after? Is that the after?
I don't want to blow you away, Randy. Okay.
Okay. Very nice.
Yeah. So imagine now that the same person comes to you and is here to sell you something for your show.
Well, they just look friendly. I mean, when people are smiling with their teeth, they look friendly.
Forget about the sales part of it. My wife's a psychiatrist. Okay.
Oh boy. Okay.
Let's not go there. Okay. But it changes their life. We take somebody that's embarrassed to smile, and they may be the nicest person in the world. They may be the friendliest person in the world. But because they're embarrassed to smile, they come across as being miserable, unhappy, unapproachable. And what we can do for them is give them beautiful teeth that look natural.
So no more dentures.
No more dentures.
Okay. If it's so good though, and you said at the beginning of the show, you said it's like 10,000 people in your area, within an hour of your practice,
Easily.
that have an upper lower denture. Why aren't they all doing it?
Somebody who has dentures, they don't think they need to go see the dentist. They don't even know what's possible. The last thing in the, some people, they get their teeth out and they're just happy to have them out. They don't think about the dentist anymore. One.
So they don't know their options.
They don't know. They have no idea what's possible.
That's interesting. Okay, good point.
Number two is people that get to dentures, most of them get there because they went to the dentist too many times. They've had failed root canals, dentistry that didn't work. They've had gum disease. They've had their teeth scraped on. I'm the last person they want to see again. Okay, they just don't want to come back in. Three, pain. They're worried about how much it's.
It does seem painful, by the way. You said it's not painful.
It's amazing. Randy, I tell you what. Let me do it on you, and we'll see. It's virtually painless. But let me be more specific, okay? Because it's an important question. Okay, it's the number one question. Why is it virtually painless? It's technology and technique. It's 3D imaging, the virtual planning, guided surgery, the precision. We don't have to mess with the gums as much. Listen.
So the gums were what were hurting before?
The gums have feeling. Bones have very little to no feeling. It was the gums. It was the amount of surgery. It's the amount of how much we had to open their mouths up. The precision of guided surgery, which is how we do our cases, makes all the difference in the world. It's the difference maker.
But what about cost? I mean, that's got to come up.
Yes, it does often. It's a big question.
Because insurance doesn't cover this in the U.S.
No, it really doesn't.
Okay.
But I think here's what's happened. Okay, people say, oh, I have 12, 14 teeth in my bottom jaw. I need 12 or 14 implants. What they don't realize is if I can place 2 implants right here and here.
So the 2 implants gives them a full arch of teeth?
Yes. On 2 implants, we can make a snap-in denture that comes in and out. But Randy, I think what people fail to realize, simply 2 implants, no more adhesive. You can eat corn on the cob. You can bite into an apple. It's amazing. I don't want to digress.
Okay.
But one of the greatest things I learned, I'd never heard this before, and it struck a chord with me, is we worry about all the chewing, can't function, all that thing. What one lady told me, what she shared with me, she said the greatest thing she likes is not having to put adhesive on, not having to go to bed before she has to go to bed with her husband, having to go to the bathroom and tear all that adhesive out, and what it meant and all the trouble with that. It's amazing what 2 implants, one here, snap-in denture come in and out.
You say that people will say that when it's all done, they should have done it years ago.
Yeah, they all say, Randy. But one case sticks out in my mind. This lady, and it kind of hits home with the whole process for us. She was living in Florida. She knew she needed implants and to replace her dentures, okay? She had gone to multiple offices. They all told her the same thing. You have to go from here to here to here to get it done. And she said, forget about it. It's too much work. It's too much trouble. It sounds way more painful than it is. She moved to North Carolina. She ended up in our office. And we explained to her that this is how we do it. We can do it in a few visits. And it's amazing what we can do. And in just a few visits, we're able to get this done. She looked at me and she said, if I had known it was going to be this straightforward, I wouldn't have waited these years to do it. And not one person doesn't tell me that.
So there's a lot of people, I guess, that it's like this woman here, the earlier on.
Yeah.
Okay. So before she gets to you, how many years did she hate her smile?
Those dentures were 30 years old.
So she was miserable for 30 years.
She's 30 years.
Now, I know a few denture wearers. I never hear them complaining about anything.
Randy, nobody likes to hear worrywart. Nobody likes to hear somebody complaining.
Okay.
You're not hanging out with them enough.
But they complain to you, obviously.
Yeah, well, I'm
They
the
tell you
dentist.
the
They want to tell me what's going on.
Time for a couple more photos. What else are we looking at?
Absolutely. This one, I just love it. Listen, it's my passion, Randy. I love these patients. I love the cases. I love
Like
what
you're showing
we
me
do.
baby pictures here, by the way.
Well, it is. It's that wonderful to me. Look at her. She's not smiling. She's unhappy.
That's her smile?
That is her. After 10 times of trying to get her to smile, that's the best I could get. She wasn't happy. She had gum disease. She had broken down teeth. She had lots of old dentistry it was just time to take these teeth out.
Okay.
It was just time. And look at the after. Look at that.
Oh, it's very nice.
It's beautiful. Humbly, it's beautiful. Okay.
So, we talked in my green room over there, and because you're a cosmetic guy, and you were saying it's one of your frustrations that you see that people go in for dental implants, but the teeth don't look good.
Yeah.
That means that it's more than just eating and chewing. You want to make a pretty smile.
Yeah. Randy, that's one of the great things that we do.
And I'm not trying to side with you, by the way. But these are great photos. I mean, it looks good.
They look fine. That's one of the great things about what we do, Randy, is in our office, we have the cosmetic artist, the implant placer, we have the technology, and we have the laboratory in the office. So we're able to sit down with patients. And one of the things I'm great at doing is I want to sit down with patients. I want to hear what they want. Some patients don't want natural teeth. They want teeth that look more Hollywood. Some patients want teeth that they say, I don't want my friends to know I had anything done. But I want them to know that, I just want to look better.
Okay.
I want to be a 7, an 8 out of 10. And some patients want to be a 10 out of 10. But that's what's great about what we do, is we're able to sit down with them, understand what they're after. They're able to sit with the laboratory, and we're able to make sure we give them.
So the lab's there too.
The lab's in the office.
So that's why it's kind of a speedy process.
Yes,
Because nobody likes going to the dentist, right? Does anybody ever?
You hurt my feelings, Randy.
Do they say that to you, by the way?
Never.
No,
Never.
I mean, do you hear it seriously?
Absolutely. Of
Like
course.
every day? Like, no offense, doctor.
Yeah. No offense, Doc. I hate dentists. Yeah.
Now,
But not you personally.
But you're
not
funny,
you personally.
You're a funny guy, though. So what is your comeback to that?
My comeback is not yet. You're gonna love me when we're done.
Okay.
You're gonna love me when we're done.
So somebody comes in, they're watching this, they have a denture, they go in. You said claim it doesn't hurt that much, very little.
You keep saying I claim. I'm
Okay.
I'm telling you.
Okay. So it doesn't hurt that much, and they can walk out with a set of teeth.
Absolutely.
I mean, how soon could they comfortably eat?
Yeah. Right away,
week?
Randy. Right away. And I think you what we're Randy, it's hard. We're not in these patients' mouths. We're not in their lives. You and I are blessed with our teeth. Okay? So we don't know what it's like.
Okay.
We don't know. I'm telling you, what happens is you walk in, we place the implants, we place the teeth, and almost right away you can chew. Certainly much better than what you came in with.
How old can you be?
It's great.
Because I guess the bone, after a while, the implants can fall out.
It's a common misconception. I hear it all the time. Oh, I'm too old for that.
How old can you be to do this?
It
'Cause I
doesn't-
guess at a certain age, the bone's not good, implants could fall out, or you're not a candidate.
You're wrong.
Okay.
It's not that way. There is no age limit to this.
Really?
Okay. Yeah, we've treated more mature patients, and
Like, what's the oldest patient that you know of?
in the 90s.
Why would a
into the
90-year-old want to do this?
Randy, it's more important for 90-year-olds to do this. When you're 90, you have medical issues. You need to eat.
Interesting. Okay.
I think we forget, when you can't eat well, you can't put nutrition and sustenance in your body. We'll go back to what we started with. It's more than teeth. It's your health. Okay, it's your overall health. This is more than just teeth. It's more than smile. It's chewing. It's your body. It's your health.
So you're going to wipe out dentures in North Carolina?
Listen. That's what we're here to do.
So, as a recap, because we're out of time, 2 implants for a denture wear, snap in, snap out.
Yes.
Right. 4 implants, still snap in, snap out. 4 implants, you get a fixed set of teeth,
That's correct.
and maybe 6 implants for certain people.
Absolutely. Here's the message. Okay. Here's the message.
Okay.
People don't realize what's possible. My first suggestion is make a decision to move forward, okay? Because it's going to change your life. Call for a consultation. I will sit down with you. My team will sit down with you, and we'll go over the options. We're going to show you what makes best. Now, this is one of the things I learned from my father, okay? And it's important. Do unto others as you would have them do unto you. When you walk into our office, you are in a safe place. We're going to treat you like family, okay? I'm not going to tell you to do something that I wouldn't do on myself, my mother, my father. We're going to treat you like family. You can rest assured that we're going to give you the best options, and you're going to know your choices. So you can do 2 implants, snap in place. 4 implants, even more stability to snap in and snap
For the
in
denture wear.
For the denture wear. 4 implants can even give you a set of fixed teeth, and 6 implants for even more control and ideal function.
Now, what about the upper denture, though? Because the roof of the mouth
Oh,
is covered, but it gives you suction. So
we didn't even get there. We didn't even get there.
What do you mean? What do you mean?
The biggest thing that patients complain about is the palate. How many times they can't taste their food? If you have a plastic denture in your mouth that covers the roof of your mouth, what are you tasting? What are you chewing with? When we can do implants,
But it stays in place, though.
When we do implants on the top,
You're ignoring my
my
statement. Okay.
When we do implants on the top, we get rid of the palate. There is no thick denture on the palate. What about patients that say they gag, the dentures are too big?
Interesting,
With
okay.
implants, we can make them smaller, more petite. I mean, it's I don't even know how to explain it. It's not even what
So
you
that's
imagine.
what they're almost happiest about, is no longer having their palate covered.
Yeah, absolutely.
So do you believe, by the way, and we're out of time, but that if the denture wearers knew how easy it was, they would all do it?
Absolutely. 100%.
Now, Medicare doesn't cover this.
No.
Insurance in the U.S. and Canada does not cover dental implants. But you'll work with them on financing and things like that.
Absolutely. Unfortunately, insurance doesn't help with this. But we have different payment systems in place. We work with different lenders that can help. We can help them make it more comfortable and more fit in their budget. And what I want to leave with on that is people don't realize. Again, I want to go back to the point. They think full arch your teeth, full implants, one implant times X number. It's not that. It's very different. Today's implant dentistry is very different. The costs are very different than what you used to think about. We have different options available to make it more comfortable for them. Just call for the consultation. We'll sit down with you. We'll go over the options, and you can make your own decision that works best for you.
Good, good. And I want to thank you for coming on the show. What's the best thing, by the way, a patient ever told you after it was all done that comes to mind?
They love me. They send me stuff to eat. I want to share a story with you.
Okay. We have about a minute, but go ahead.
Yeah, absolutely. One of the best things is a patient said to me when she first came in for her consultation, she said, I haven't ate a steak in so long. You don't know what it's like to buy a steak and have to cut it up, not really be able to enjoy it. And I told her when I looked at it, I said, when you're done, you're going to be able to eat a steak, apple, corn on the cob. And I was so right. What she did was she sent me a gift certificate to go to a fine steakhouse. And
nice.
it was very nice. It was, it's amazing what we can do for people.
Well, thank you for coming on the show.
Thank
Very,
you,
very
Randy.
good. And
It was a pleasure. I hope I taught you something.
You did. You did. You got me excited about this.
Yeah,
I
that's
guess
good.
no more dentures.
And when we talked before, you weren't excited at all.
Well, I thought, well, dental implants not that exciting, but you're right.
Yeah.
I guess nobody should be wearing dentures. But if they want to see, if you only caught about 10 minutes of this interview, we'll give you a copy to put on your website. They can go to your website and view this in its entirety. Again, great stuff. Great information.
Thank you very much. Thank you, Randy.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.